We're really excited about the Heart Valve Clinic, and it has two, I think, fantastic new things that we think can benefit the patients of Central Texas, folks with heart valve disease.
The typical fix for an aortic valve narrowing or aortic stenosis is a replacement of the valve. And historically that was always done with a surgery or open heart surgery that's done through the chest. Newer technologies evolved and is now available where we can replace the valve without entering the chest by going through the groin. We use a small catheter that goes through the arteries of the groin up to the heart, where we replace the valve by working from the inside out instead of from the outside in. It's called TAVR or Transcatheter Aortic Valve Replacement, TAVR.
For many patients, the transcatheter aortic valve replacement procedure is the only thing that will help them feel significantly better and help extend their high quality life. And so that's really important for us, is to identify folks that we can help with this and then perform the procedure when it's indicated and safe.
Don Anderson's a very active man. He lives out in the hill country and he likes to get out and about, and one of the things that his wife had noticed is that he was doing less and less and less.
My breath became shorter, and as time went on, I noticed more and more I was just huffing and puffing and huffing and puffing after very little effort. I don't experience that anymore. Just immediately after the surgery was completed, I was breathing normally. It's absolutely amazing, absolutely amazing.
The procedure is done by surgeons and cardiologists jointly, and the reason for that is surgeons are used to doing open heart surgery and know the anatomy of the aortic valve, and we're able to treat complications that may arise as a result of implanting the aortic valve. And cardiologists have experience with catheters and wires and going up through the groin, and so each of us brings different things to the procedure. So we do them jointly, and therefore it gives the patient the best option.
Severe aortic stenosis is a common illness, and we have a very good treatment for it, which is surgical aortic valve replacement. But for many, many patients, they are not able to go through that big heart surgery. And so for those patients in the past, there were really no treatment options. And so this is less invasive and allows folks to get back to their usual things more quickly. And so far we've seen great results.
The next morning I ate solid food. After I had my breakfast, they said, "Would you like to take a walk?" I said, "Well, certainly." I got up and I walked up and down the corridor. No problem at all. No problem breathing or anything. I was in the hospital that day and then the next day, and then I think we went home.
The technology to treat valve disease has evolved pretty rapidly in the last few years, and options are now coming up that previously patients weren't able to have.
Austin Heart is remarkable. The team of surgeons that did this job, I have the utmost respect for them. The skill, the expertise that they have is just absolutely astounding.
Well, this is probably the best part of this whole endeavor, is to have great folks like the Andersons come back and for us to see the tremendous benefit that they've enjoyed in terms of just feeling better.
If someone else was experiencing a problem with the aortic valve and they were having a problem, it's not going to get better, it's just going to get worse. Please have it done for your own good. It's the difference between night and day. You'll have, the whole world will be open for you again. You can do anything that you want to, anything else that any part of your body will allow you to do. It's just absolutely amazing.